An Emanuel County teacher fighting for her life on a ventilator in an Augusta hospital after she got the coronavirus. News Channel 6's Renetta Dubose spoke with her sister about what happened. She also talked to a healthcare leader who says this pandemic has really tested the system's strength.
Shanray Brooks started the school year like many other teachers, ready to educate in person despite a pandemic. But shortly after the assembling, her fears came true. Brooks always shared excitement about the first day of school, but her sister Shantae Smith says the coronavirus pandemic clouded that joy this time around.
She was concerned about returning to school too soon, and being exposed. So she didn't want to go back.
But the 7th grade Swainsboro Middle School English teacher returned to the classroom August 3rd as planned by Emanuel County Schools leaders.
She's the teacher that at night cooks grits in a crock pot to bring to her students so they can eat before testing.
That type of dedication shown to students is now being redirected to saving her own life. Smith says a few days after school started, her sister became ill with headaches, nausea, chills, and overall weakness. She later tested positive for COVID-19.
I had someone to take her some like Gatorades and soups and put on her doorstep, and she said, "Tay, thank you so much." She said, "But I was so tired, I could only get them off the porch and place them by the door. I couldn't even take them any further." She said, and I had to sit on the sofa and just get some strength to even go back in the room. She said, "I'm in the bed now."
Smith says her sister is now in an Augusta hospital on a ventilator, a reality many with respiratory issues like Brooks has face when infected with COVID-19. Smith blames the ordeal on the failure of Emanuel County schools to share COVID numbers at first. News Channel 6 found coronavirus numbers for all schools online now and the district's reopening guidelines. They include staying home if symptoms develop, temperature checks, and hand washing. Employees are encouraged to wear a mask, and so are students, but it is not required. We checked in with Emanuel Medical Center CEO, who works with 3 agencies to track the virus.
Early on, we were having about a 5% positivity rate, and it's that much. I would say that we peaked in August, but September we're just as strong.
Damian Scott says he believes community spread started late July, and by mid-August, hospitalizations began to spike and ultimately test his rural community system. Caring for critical patients became a challenge until he teamed up with Augusta University's telehealth program, and GEMA sent critical care nurses.
Your hospitals, not just us, we are so much more equipped to handle the pandemic than we were early on.
While Smith is sending a message for her sister to keep fighting, Scott says that the medical center teamed up with a local college to send out the message to mask up. Renetta Dubose, WJBF News Channel 6, back to you.